Thank you, Dr. Metz. My name is Jessica Lutz.
And I'm Mariah Hakovich.
For our scholarly project, we investigated if adding meaning during messy play enhances fine motor skills use and sensory gating in young children. Meaningful occupation is a key component in occupational therapy practice. The term occupation can be defined as the daily life activities in which individuals engage. The term meaning is an active process of the individual which is determined by his or her perceived thought on a particular environment, event, or occupation. Occupational therapists believed it was important to integrate meaning and purpose into occupations conducted during practice. To create a meaningful occupation for a client, the occupational therapist must tailor the intervention to the specific individual's needs. Specifically, occupational therapy has been involved in a broad spectrum of therapeutic occupations so that the therapist can elect a meaningful response for the client based on their performance skills and client factors.
One important client factor that can affect meaningful occupations is the individual's sensory processing. Sensory processing is the way an individual takes in and responds to the stimulus in his or her environment. Emotions, thoughts, and actions of an individual may often be a result of how his or her sensory information was brought in and processed. Some of the variability in sensory processing is a result of modulation. Modulation is the ability to regulate information perceived from an environmental stimulus to generate an appropriate response. In order for a stimulus from the environment to be processed and reacted upon, it must reach a threshold of the nervous system. Thresholds are different for every individual and are determined by the habituation and sensitization to sensory stimuli. Habituation can be described as a decrease in response upon repeated presentation of a non-threatening stimulus. When sensory input has been previously processed and perceived as something that does not require the individual's attention, habituation to the stimulus results. Habituation is the body's way of accepting and adapting to certain stimuli. In other terms, habituation can be referred to as gating. Gating is the brain's natural response to ignore or turn away a sensory stimulus because it has been deemed useless or irrelevant to the situation. For the purpose of this study, we focused on the impact of sensory processing ability in children, specifically children with sensory sensitivities. Individuals with sensitivity to stimuli tend to experience an enhancement of their senses in order to recognize a stimulus as important or potentially harmful, which therefore generates a heightened response. Motor actions directly convey experiences through sensory feedback. A child actively selects the motor action that is most useful to them depending on their environment and sensory input. These responses could be a barrier for children because sensory sensitivity can prevent a child's opportunity to participate in their environment, such as their fine motor skills. When the child's process is well organized, they are able to carry out an action and adapt the response if needed. In order to recognize these sensory processing changes in the neural activity, P50 gating is used. The P50 is a component of the characteristic electroencephalography (EEG) waveform recorded in response to a stimulus. P50 gating is the difference in responses between two presentations of the same sensory stimulus. The first stimulus is referred to as the conditioning stimulus. The second stimulus is known as the test stimulus. P50 gating is determined by dividing the amplitude of the response to the test stimulus by the amplitude of the response to the conditioning stimulus. This gating response is viewed as the brain's ability to regulate a sensation and show the sensitivity an individual may have with the stimulus. In typically developing individuals, repeated and non-threatening stimuli are often gated out. Whereas in individuals with sensory sensitivities, the brain has difficulty gating them out, resulting in a neural reaction each time the stimulus is present. It is thought that engagement in the environment can help a child's nervous system to be self-regulating. These interactions help children develop the ability to classify different stimuli as threatening and non-threatening and assist with gating. However, children with sensory sensitivity have trouble engaging in their environments due to avoidance and distractibility with increased stimulus input from the lack of gating. In order to actively engage these children in the environment, it is thought that adding meaning may increase their participation. Occupational therapists have begun to question the impact of meaning on sensory gating. Joe completed a study with healthy adult participants where they rated images suggestive of tactile sensation as positive or negative. They measured P50 gating as participants looked at the images while imagining having the suggestion of tactile experience. Participants' sensory gating while looking at the positively rated images was significantly less than in the control condition. When looking at negatively rated images, participants' gating was also decreased, but not significantly so. While most literature suggests that sensory gating thresholds are low when in the presence of unfamiliar or unpleasant stimuli, Joe's results indicated that the participants' sensory gating was decreased when there was presented with positive stimuli. While this is contrary to most literature, it may suggest that meaning influences sensory gating.
In addition to sensory processing, fine motor skills are a performance measure that can affect meaning during occupations. Fine motor skills are the ability to use small muscles of the hand with appropriate dexterity, strength, and coordination to manipulate and grasp items of different sizes, shapes, and weight. These skills start to develop during early infancy, allowing for exploration of the surrounding environment. These skills are learned over 3 stages, including exploratory activity, perceptual learning, and skills achievement. The first stage is exploratory activity. This stage allows for the child to experiment with new items, testing out different combinations of precision and movement. A child's lack of exploration and/or interest of their surrounding environment early on could limit their ability to acquire fine motor skills necessary to complete simple to complex occupations through development. Additionally, a child's perception of their environment and objects within it allow for an action to occur, delivering feedback about their movement and performance, leading to discuss the second stage of motor development, perceptual learning. A child is able to start using the feedback received through their exploration during this stage. For example, having numerous of elements in a child's environment affords an opportunity for them to manipulate items with their hands to understand the shape, weight, texture, and consistency. The performed motor actions can aid in identifying sensory and perceptual characteristics of an item. Classifying that affordance is the link between a child and their environment. Affordance allows a child to explore activities that provide the opportunity to complete motor actions with their hands, including isolated finger movement, opposition, hand-to-hand transfer, and in-hand manipulation. Opportunities for exploration allow for novel actions to develop, permitting new affordances to open up to improve fine motor skills through development. The final phase of motor learning is skill achievement. After many attempts to use an object, the child chooses the action pattern that works best for them in order to accomplish the intended goal. A study conducted by Miller and Metz hypothesized that suggesting themes for pretending during play would enhance engagement in messy play with school-age children. Their results suggested children with sensory deficits demonstrated to not avoid the distasteful materials when pretend meaning was applied as compared to no meaning available. When no available meaning was offered, the children with sensory suggested deficits demonstrated to have a lower initiation score, demonstrating to be hesitant and avoidant of the materials. With their indications, this suggested meaning can encourage a child's participation in occupations with messy substances. While their findings suggested a change in behavior response, it is still unknown how adding meaning with sensory stimulation may affect the child's nervous system. Given the indications from their results, it has led us to replicate their methods in our present study. So given the information from the literature review, we found that different client factors and performance skills can have an impact on meaningful occupations. However, this information made us question the opposite. Can changing the meaning of an occupation affect the client factors and performance skills during play? The independent variables of adding meaning or no adding meaning were the same in both of our studies. Therefore, we conducted and collected data together. While our studies were similar, we looked at different dependent variables. Specifically, I wanted to test the hypothesis that if adding meaning is applied, children will use their hands more skillfully when engaging in play with messy substances.
While Jessica looked at the change in fine motor skills of the participants, I wanted to research the neural changes in response to play with messy substances. I predicted, based on evidence from previous research studies, that adding meaning during messy play would increase gating and response in children.
For our studies, we recruited children between the ages of 5 and 10. Children were only excluded from our study if they had a dermatological condition or seizure disorders. For convenience, we recruited participants in the greater Toledo area. The inclusion criteria for our study was appropriate motor control, cognitive functioning, and clear communication. We wanted to make sure the children in our study had enough motor control to be able to control fine motor movements during play in the messy substances, as well as make sure they could follow our simple instructions for tasks and the ability to experience pretend play during the experimental condition of the study. Another thing that was extremely important to us was that the child had a way to communicate. It was crucial that the participant was able to communicate yes, okay, no, stop, all done, so that we were never putting the child in a position that they felt uncomfortable.
In order to conduct the study, all participants attended 3 sessions: an initial session for consent forms, assessments and getting acquainted with the equipment, and 2 data collection sessions, one in each the experimental and control setting. Upon arrival for session 1, they were given a tour of the preparation room and the messy playroom. They were given a brief description of what would happen in each room when they came for subsequent sessions. Participants were encouraged to try and feel the equipment to get acquainted with it prior to data collection. During this time, the parents also completed forms like a consent form, a demographic questionnaire, the Connors 3 short form, and the sensory profile 2. While the parents were completing forms, a researcher practiced communication and the Likert scale rating used for the substances, but with the participants using common foods that children eat. The child ranked the pictures of the 5 foods from least likely to eat to most likely to eat, and the accuracy of the ratings were confirmed by the parents. In this study, we used a few different pieces of equipment with the participants. First, in order to measure the EEG amplitudes, we used a cap that connected to 16 skull electrodes and 18 different auxiliary electrodes. In order to get stereotyped EEG responses to provide input to the somatosensory system, we used an MNS, which is an electrical stimulation that is delivered to the median nerve at the wrist of the non-dominant hand. The stimulus can be described as mildly uncomfortable, but it's not painful. In this study, we determined that participants' threshold for the stimulus before every data collection period to ensure that the stimulus was acceptable for repeated delivery. The specific device we used had a maximum output that is not high enough to cause any tissue or nerve damage.
For session 2 and 3, they consisted of data collection under the experimental and control conditions, which were randomized. The agreement of the child participant was obtained each session by explaining what was going to happen to the child. We used appropriate language throughout the sessions and asked the child if he or she is willing to advance. If a child did not wish to continue, we rescheduled the day's session. Preparation occurred in a small playroom within the same suite for both studies. Preparation consisted of applying the EEG cap, auxiliary electrodes, and the MNS stimulator. During preparation, the participants also ranked 5 randomly selected substances using the Likert scale. There were 10 messy substances that were used for tactile play within the study, some of which are displayed on the slide. The participants were asked to score the 5 substances from I would least likely to play with to I would most likely to play with. When it was time for data collection, one researcher told the participant that they were going to play together for 10 minutes. The researcher gave instructions using a standardized script that comes from either the control or experimental condition. The experimental condition, the narrations reflected the pretended meaning introduced in the script. For example, I am spreading toothpaste on a toothbrush, and it must be time for bed because we're getting ready to brush our teeth. While the control condition, the narration did not invoke pretense. The researcher then lifted a box to reveal the substance. At the same time, the researcher began the MNS manually by pressing the button on the response box. Throughout the messy play, a minimum of 100 pairs of MNS were delivered. These pairs were delivered once every 5 seconds until the participant was done playing. Data collection was recorded via EEG software and 2 handheld video recording cameras during messy play.
21 children provided assent and completed 2 sessions of messy play. There were 13 females and 8 males. The average age of the participants were 8 years old. Of the 21 participants, 2 were left-hand dominant and 19 were right-hand dominant. All participants were able to communicate verbally. A few participants had medical diagnoses, however, none of these were directly correlated with any sensory processing or fine motor deficits. The results of the sensory profile showed that 3 participants had scores that indicated concerns with either sensory sensitivity or sensory avoiding. Additionally, the results of the Connors 3 short form showed that 8 participants had concerns of hyperactivity above 1 standard deviation. Now that we've discussed our methods, we're individually going to talk about our results. To start, we'll look at the results of my study, which was does adding meaning during messy play increase gating of somatosensory evoked potentials in children? In order to measure gating of sensory input during messy play, we use test to conditioning stimulus ratios, or TC ratios. A TC ratio is calculated through comparing the amplitude of the P50 evoked by the second stimulus in the pair to that of the wave evoked by the first stimulus in the pair. As previously mentioned, during the data collection sessions, participants experienced 100 paired stimuli through the MNS. These paired stimuli are what we use to calculate the TC ratios. A gating ratio of 1 would indicate that no gating occurred. Ratios less than 1 indicated that the second stimulus was gated out, and ratios greater than 1 indicate a larger response to the second stimulus than to the first. To analyze the results of the EEG recordings, gating ratios were derived for each participant's play session. The data collection was not normally distributed, and therefore we compared gating ratios using Wilcox-Sines rank test with an alpha level of 0.05. This image depicts the results of P50 somatosensory gating during messy play. As you can see on the graph, the y-axis shows the level of the gating ratio, with a score of less than 1 meaning gating has occurred. As you can see, neither the control nor experimental conditions exhibited sensory gating. The control condition, which was no meaning, showed that participants had a larger gating ratio of 1.76 when compared to the experimental condition or the meaning condition with a gating ratio of 1.205. The TC gating ratios were closer to 1 in the experimental condition than in the control condition, but the difference was not significant. Before jumping into discussing the results of my study, I wanted to provide a quick reminder of what gating actually means in relation to a person's feelings and responses. Research has shown that gating of stimuli is perceived as the person allowing the stimulus to pass through with a reaction. If a person does not gate the stimulus, it is believed that the stimulus is still thought of as somewhat unfamiliar or threatening. So, as my results showed, on average, neither the control or experimental conditions demonstrated gating. While both conditions had a score greater than 1, the experimental condition was closer to 1 than the control condition, or that the participants were closer to gating during the experimental condition when compared to the control condition. This may suggest that adding meaning, as was done during the experimental condition, increases the possibility of gating. Additionally, it may be important to consider the aspect of play in the study. 3 different participants were likely to have found the stimulus associated with messy play to be adverse, as indicated by their sensory processing patterns. This information is important to consider when comparing our results to a similar study conducted by Miller and Metz. The study found that children identified with sensory sensitivities were quicker to initiate messy play when they were added meaning. This information may suggest that the few participants we had with sensory sensitivities in our study may have exhibited the same reaction, except that our sample size was too small to compare. A similar study was conducted by Davies and Gavin, where they researched the different gating patterns between typically developing children and children with sensory processing disorder when presented with auditory stimuli. TC ratios from the sensory gating paradigm were 0.58 for typically developing children and 0.77 for children with sensory processing disorder. These results showed that gating occurred to a lesser extent for children with sensory processing disorder, suggesting that the stimulus provided was perceived as more confusing or unsettling than it was for the typically developing children. The TC ratios from our study were 1.76 for the control condition and 1.21 for the experimental condition. While the results from our study showed no gating in either condition, as both gating ratios were greater than 1, the condition, or no meaning group, was further from gating. When comparing the results from Davies and Gavin's to our results, it may suggest that the play with no meaning may have been perceived as more unsettling than the experimental condition, and therefore less gating was noted. A study by Orakova used paired auditory stimuli to test their hypothesis, which was that children with autism have an imbalance of neural excitation and inhibition, and therefore do not demonstrate sensory gating as frequently as typically developing children. On average, the children in this study exhibited very little gating when compared to the control group of typically developing children with very robust gating. For the current study, there was no gating in either condition, but gating was closer to occurring in the experimental or meaning condition. While the gating results are different, the comparisons are interesting. Less gating was noted during the control condition of the current study, where there was no meaning. Less gating was also noted in children with autism in Orakova's study. This is important to consider when looking at the stimulus presented. The participants with autism may have found the stimuli presented unpleasant to listen to, similar to how the participants in the current study may have looked at the messy play in the control condition, therefore resulting in less gating. The results of Orakova's study also showed that the greater the sensory difficulty faced by the child, the less gating occurred. This can be related to the present study through the noted results of the sensory profile. There were 3 different participants that showed concern with sensory processing, either sensory sensitivity or sensory avoiding, on the sensory profile. These concerns may provide a reason as to why gating did not occur in the present study when compared to the results of Orakova's study. Overall, these results may suggest that adding meaning to situations or experiences that are unfamiliar or threatening to children may provide more comfort or ease and increased gating. The occupational therapy profession puts a large emphasis on meaning when working with children. Occupational therapists work under the understanding that each individual is different and therefore tasks should be modified or adapted to provide meaning and purpose to the client. The results of our study are supported by similar studies in saying that adding meaning enhances occupational engagement and success in activities. The more value and meaning an activity has on a child, the more work is put in and the more active the child is during the task. Therefore, the continued use of adding meaning to tasks by occupational therapists can help provide children with more pleasant experiences in their daily lives.
Now we are going to transition and look at the results from my study. Measurement of fine motor skills that was selected and being observed in my study included in-hand manipulation, gross grips, and precision grips. I also obtained findings on the participants' gross motor skills, including wrist, forearm, shoulder, and elbow motion, crossing midline, and bilateral upward striding movement, a total of 9 categories and 27 subcategories, demonstrated by the dominant and non-dominant hand during each condition of 20 participants. Data analysis of the participants' skillful hand use was conducted by tallying each observed skillful hand use selected. Additionally, comparison of the child participants' skillful hand use of the dominant, non-dominant, and bilateral hand was completed. We used the Wilcox-Sign rank test to compare the child participants' dominant and non-dominant hand use during 2 conditions in order to compare the 2 related samples. Of the 20 participants, the average total number of incidences of fine motor skills used while playing with messy substances of the dominant hand was 156.1 plus or minus 54.8 in the control condition, and 154 plus or minus 78.1 in the experimental condition, representing no significant differences as seen in the figure. The average total number of incidences of fine motor skill hand use while playing with messy substances with the non-dominant hand was 61.1 plus or minus 56.5 in the control condition, and 50.4 plus or minus 37.5 in the experimental condition, representing no significant differences as well seen in the figure. Individual fine motor skills and bilateral hand use shown in the figure did not show significant differences between the 2 conditions. The data indicates that participants did not use their hands more skillfully when playing with distasteful substances when engaging in meaningful messy play. As a reminder for this study, we sought to examine if adding meaning was applied during messy play with distasteful substances where children use their hands more skillfully. This is important to address as object handling plays a large role in an individual's ability to engage in purposeful activities. A similar study conducted by Sacolo, Strauss, and Rice investigated the extent to which meaning affects the proficiency of reach movement with adults while grasping for sweets of that they preferred to varying degrees. Their findings demonstrated that adding meaning influenced the adult's motor performance by revealing greater movement efficiency when reaching for a greater preferred candy. In the present study, we analyzed a number of proficient motor skills with children to gain a clear understanding of how adding meaning might affect the use of fine motor skills. We anticipated that when adding meaning in pretend play, children would use their hands more skillfully with messy substances. Our findings are not consistent with Sacolo, Strauss, and Rice, who provided evidence that adding meaning affects a person's occupational performance. Secondly, with the unique nature of this experimental design, there is no previous research that has investigated in the context of children's fine motor skills while playing with messy tactile substances. Previous studies have examined fine motor skills during isolated task performance. However, only one aspect was assessed, specifically in-hand manipulation. Exner's conducted a study assessing an in-hand manipulation test that was developed for occupational therapists to assess young school-aged children who may be at risk for motor development problems. Participants were asked to perform a task by following basic directions while handling different size objects. As a result, the raters indicated several limitations in the in-hand manipulation tool, but the children tested in the study were successful in task completion regardless of their manipulation strategies and seemed to enjoy the activity. Although Exner's primary objective was to create a reliable standardized tool, one key difference is the current study may have not provided sufficient affordance to elect in-hand manipulation skills. We did not provide objects for playing as Exner did. The physical characteristic of messy play substances do not offer many elements to pinch, grasp, rotate, or store in the palm of their hand. The nature of messy play substances did provide an enriched environment with materials, but may not have offered the opportunity for a child to use refined motor skills, which is evident in the way the child used their hands in both conditions. Although the children were able to manipulate the messy substances with their hands in order to understand the texture, consistency, and weight of the materials, suggesting that the children were identifying different affordances while recognizing sensory and perceptual characteristics of the material when completing various motor actions with their hands. Lastly, the study that was conducted was with children who were considered typical developing and would not be comparable to children of no diagnoses. Further research is needed to explore this concern. The findings from our current study and previous literature may provide insights for occupational therapy practitioners. Our results suggest that adding meaning during tactile play with messy substances may not increase a child's use of fine motor skills because perhaps the nature of the messy play does not present much of a demand or opportunity to use fine motor skills, whether the therapist introduces a pretend meaning or not. Secondly, it was implied that the introduction of meaning can increase the engagement in messy play, as this was seen in the Miller and Metz study, indicating that this could be a useful initial strategy to warm a child up in using their hands in therapy. Lastly, utilizing messy substances may encourage active participation for a child. Play has been thought to aid a child to build skills in both sensory and motor, indicating that play with messy substances could be a motivator for a child to explore and interact with their environment.
There were multiple limitations that could have affected the results of our studies. Ones that were similar for both of us were the sample size, the rating of substances, and the concept of meaning. While all of the limitations are listed on the slide, for the sake of time we will be discussing the biggest limitations to our studies, which are highlighted on the slide. First, we had no control over the participants' interpretation of meaning during data collection. While we tried to induce meaning in the experimental condition and restrict meaning in the control condition, we had no way of controlling the participants' thoughts or feelings of meaning during play. There was also the potential that the participants were familiar with the messy materials that they used and already had a perceived meaning of the substances prior to the start of the session. My personal study was also affected by the participants' MNS threshold tolerance. Each participant had their MNS stimulus set to an individualized threshold based on their tolerance. The limitation I faced was the accuracy of participant recognition of the stimulus while determining threshold. Participants often got confused on whether or not they felt the stimulus while determining threshold, and often made contradicting statements on feeling recognition at the same stimulus level. Additionally, because the thresholds were set so low, we also could not be sure that the participants continued to feel the stimulus throughout the play. This therefore may have resulted in a lower or inaccurate threshold setting and may have potentially skewed the results of the EEG measurements during data collection.
My personal study had additional limitations. One possible limitation is the structure of the study during the second and third session. Participants were to engage in messy play with no instructions on how to manipulate the materials, but provided the opportunity to observe the researchers engaging with the messy materials, possibly mirroring the performance of the observed hand skills being demonstrated. This could have prevented participants from demonstrating additional skillful hand skills. Based on the findings from the literature review and the results of our studies, further research is necessary. The topics addressed in our studies need continuous research with a larger sample size in order to demonstrate significant findings and more variability of participants in order to show causation. Specifically, research needs to be completed with children with sensory sensitivity in order to accurately determine whether or not gating is affected by the diagnosis. Additionally, research should ideally be completed with higher MNS thresholds in hopes of producing bigger amplitude waves to determine gating ratios. Although we do not have evidence to support this statement, perhaps modifying the task to include small parts and/or use of tools that offer opportunity for affordance could encourage fine motor skills. Additionally, as play is an aspect of intervention in the therapy setting for pediatrics, clinicians can provide a meaningful element of engagement with sensory substances in order to advance skillful hand use in a child. In the summary of my study, we explored whether adding meaning will encourage children to use their hands more skillfully in play with messy substances. While the results showed the application of adding meaning to undesirable messy substances did not affect the use of fine motor skills in young children, they do suggest that further research should be considered. This is because no publications have yet to test this hypothesis, indicating that there is limited data collected and recorded that aids in supporting this predicted theory.
My study explored whether or not adding meaning to messy play would increase the P50 somatosensory gating in children. We hypothesized that with adding meaning, children's sensory gating would increase. While the study did not provide significant results and the participants did not show gating in either the control or experimental condition, the results did show a closer tendency towards gating during the meaningful messy play experience. In typically developing individuals, repeated and non-threatening stimuli are often gated out. This may show that the participants experienced less non-threatening stimuli during the meaningful play experience, allowing participants a more successful sensory experience. We would like to thank Dr. Metz for all of our guidance through our research studies. We'd also like to thank each other for the endless support we provided to each other through this whole process. And finally, we'd like to thank the class of 2020. We're so sad we can't be together right now to celebrate, but we did it! Here are our references. Thanks for watching. We look forward to talking to you and answering your questions in a little bit.